So let me begin from the concept of thyroid care in Ayurveda, and also we discuss some of the cases, how really we treat thyroid and what levels of success we have if at all we happen to treat this condition. As we all know, that thyroid disorders are one of the most common disorders of the endocrine gland, second to diabetes. There was a period people believe that it was second to diabetes. Now it is much more higher than the diabetes, and maybe also a comorbidity to diabetes, which comes and alarmingly increasing, at least in India, because of many reasons. One of the reason to increase in India also because of the universal iodization, which happened in 1980s, because in the government has propagated a propaganda by the WHO, World Health Organization, that all the salt what we consume supposed to have iodization, which could be very beneficial for the people who's really lacking the iodine, which is one of the part of the constituent in the thyroid hormone, the T3 and T4. But very unfortunately, due to overconsumption of this iodine in our food, as well as we Indians, we, especially the South Indians, we habituated to eat a lot of salt, which we don't need that much, and a bounce back of this overconsumption of salt manifested a large number of people emerges with hypothyroidism. That's a reality what we see. But whatever, the statistics says that around 42 million people are suffering from thyroid, at least in India. Maybe it may be much more, because there are a large number of people are having subclinical hypothyroidism, which they may not be able to face, or they may not be able to reach into a doctor if, since, and most of the symptoms are very unusual symptom, or many of the symptom may be mimicking like a premenopausal syndrome, or maybe even just a stress induced symptoms. And unfortunately, women are 6 times more prone than men. I mean, women are 6 times more prone than men. But the pathetic situation is that if the thyroid cancer comes, the situation is in the reverse. Men are more prone to get thyroid cancers, and they die faster than the women. So men cannot feel very happy. In general, as we know, the thyroid gland can manifest multiple type of diseases, maybe hypothyroidism, where the hormones are not really working well. Whereas another side, where the thyroid hormone increases its secretions and it diffuses the whole system, producing hyperthyroidism, where every activity is much higher. And the third thing is a goiter, none other than just like we can say, just like a hydrocele in the scrotum, we can say the thyroid gland is a thyroid seal. There is an enlargement of gland, which is maybe not directly related to the existing thyroid disease. Maybe it is associated with some of the pathologies which have happened in his life before. And again, we have iodine deficiency disorders and thyroid, Hashimoto thyroiditis, thyroid cancer and all. But at this short period of time, by and large, I will deal hypothyroidism and hyperthyroidism, and I exclude other diseases except the Hashimoto thyroiditis, because these 3 things may be most importantly what we want to know, and these are the diseases oftenly we come to in our clinical setup, and we could be able to do something in that. And out of all these 3, from Hashimoto thyroiditis to hyperthyroidism and hypothyroidism, hypothyroidism is one of the most common disorder in relatively in these 3, which comes often in the clinic and oftenly treated with many people. So statistics again says that in India, every 1 in 10 affected with hypothyroidism, and most of the time, as we all know as a clinicians, patients complains with hair loss, unexpected body weight, or maybe some feel hormonal imbalance and all. They go for a clinical routine checkup. Nowadays, people are much aware of this health condition. So they know, obviously, they check for the T3, T4, TSH. So immediately they found an increase of TSH, maybe 15 or 20. And they maybe get surprised to see this hike. Maybe it can even happen in physiological situation. That's another scene. But they immediately go to an endocrinologist just by this report, and they will switch on to the thyroxine or the levothyroxine, or what in the society what we say thyronome, maybe 25 mg, 50 or whatever, depends upon the need of the body. The funniest thing happens in the later situation is that once they start these medications, many people find some good results because they will reduces their symptoms and they'll be happy. But over a period of time, they'll not be happy, because even though biochemically things are quite normal, but symptomatically they have the same problem. Maybe because of the cellular resistance created in the system, or maybe other reasons, but they are really in a trap because they keep on taking this medicine. So they are in a big confusion. What shall I do? So they again go to a consultant, ask, doctor, I started taking now the thyroxine from last 1 year, and but unfortunately still I have some of the symptoms, like I have a huge hair loss, I have a feeling putting on weight, like water retention in the system, I have some irregular menstrual cycle, and so on. So what shall I do? So the doctor says maybe your system maybe demand more the hormone. So now you're taking 50 mcg, you just increase the dose into 75. So the patient are really confused, or the patient are really upset about the responses from the endocrinologist, and they may be looking for help from an alternative system. They generally look for Ayurveda in the country, so they ask for help from Ayurvedic practitioner. Shall we do something for this? And very fortunately or unfortunately, in our Ayurvedic textbook, we don't have much descriptions. So we are very unfortunate that we don't have any direct description of any of the disease. Maybe we have descriptions like Galagandam, Gandamala. These are all very late manifestation of thyroid dysfunctions. Not many times, it's not necessary to be a thyroid dysfunction in many cases. So we are very fortunate that we don't have any description, so we can evolve, we can develop our own diagnostic, our own dosha dusha vivechanam, so we can think over accordingly. So whatever, the patient, first thing they will ask to an Ayurvedic clinician is that, doctor, I am taking thyroxine from an year, my T3, T4 is normal. Sometime my TSH is having some fluctuations, and doctor told I have to continue this tablet for lifelong. Do you have any options with you? I'm happy with the medicine what I'm taking, but I'm not happy with the symptoms what I have now. Do you have any options? Do you have a co-prescriptions with this medicine through which I could able to overcome the symptoms? Or do you have something by which I could be able to reduce this dosage of this drug? So most of the time, as a general practitioner, we may be a little bit helpless. So obviously, we may switch on to some trial and error methods. We may give some medicines depending upon the symptomatology. For example, person is telling, I'm putting on weight. Okay, let us try Varanadikashayam, because it's very good for reducing the weight, and it's also very good for some of the associated symptom patient have, like headache, etc. Maybe some symptoms, some symptomatic relief will happen, and maybe we'll switch on to the so-called Kanjanara Gugulu or whatever the drug we give. It is a trial and error method by which we try to reach to a situation that, okay, let us have a co-prescriptions with the thyroxine. So what I'm going to speak is a situation is a wider range, that we have to understand this pathology, what is happening there. Then we can have a parallel perspective of this disease from Ayurveda. Then we can think of enormous dimensions of this. A prescription, there is no quick fix. We can have a prescription according to the customization of the patient, what they have the symptoms, and we can proceed. So what is happening actually, the thyroid? Actually, it's very simple, because it's like a battery of our mobile. It is very essential. It is very essential that contributes in the energy uh, given to the whole system, because if thyroid gland functions properly, we'll have a proper basic metabolic rate, we have a glucose catabolism in our body properly, lipid metabolism in a properly, and we have proper appetite and protein synthesis well. Even our most of our functions, cardiovascular, musculoskeletal, including reproductive system, it's almost thyroid reaches, that is triiodothyroxine and tetroidothyroxine, reaches almost everywhere in the system, almost every cell in the system, because it has to get into the system and link with the endoplasmic reticulum and converting the ATP and the whole story. So anyhow, so that is the thing. So it's like a battery. It's like a Agnireva Sharire, Pittandargada, Kubida Kubida, Shubha Shubhani Karodi, like Charaga mentions, like that, something like that. And if you look at from Ayurvedic point of view, it's there. It reflects almost the five vata from Udana, the Vyana, then to Samana, then to Apana, because it have influence to all the dhadus, from Rasa dhatu to Shukra dhatu. We have thyroid dysfunction, which produces the dryness of the skin, like from Tuk, and we have blood problems, then we have musculoskeletal problems, including reproductive system with an infertility. Very often, hypothyroidism, one of the major reasons for infertility, especially in the male. In female also, which is co-associated with PCOD. So actually what happens, one side, as we can understand that there is a connectivity from hypothalamus, pituitary and thyroid connectivity. So hypothalamus secretes the thyroid releasing hormone. It goes to the pituitary, which produces the thyroid stimulating hormone. From pituitary it goes to the thyroid gland, produces T3 and T4, and it just from a thyroid gland, it stores a large number in its in the parenchymal thyroid. Then there it diffuses to the whole system, and wherever the is necessary, it just do that. By a large T4 is available in the whole system, but T4 is not directly acceptable to the cell, so they will lose one iodine, so it becomes T3, that is triiodothyroxine. That is called free T4. Normally when we check blood chemistry, we check the free T4. That is the important thing, because that shows the demand of the system. Anyhow, it goes to the cell. So from Ayurvedic point of view, there is a nidanam. We don't know what it may be, the nidanam. There is an increase of kapha vriddhi if it is a hypothyroidism is concerned. So they will have a Guru Gatarda, Ruji, all these symptoms, and Agnimandya happening, Ama Pravrti, then from Rasa Dushti, Medo Dushti, Sarahinada, and it go to the all the dhatus. Very interestingly, if you look at the symptoms, normally if you have a hypothyroidism, we have there is a decline of T3, T4, maybe of different reasons. Because of that, people have fatigue, weakness, weight gain, constipation, cold intolerance, maybe edema, even some angioedemas happening, muscle cramps, some paresthesias, very common in adult paresthesias like carpal tunnel syndrome, mimicking like a carpal tunnel syndrome, menorrhagias, many things. And if you go more detailed, we also will see there is a hair loss. So there may be some changes in the tongue, especially if it is a children. It is very critical. If you have a child brought in your OPD and the child tongue is a little bit protruded, be very, very, very careful that mostly the child has some thyroid dysfunction. Very, very simple. There are very simple technique by which we can reach into a thyroid dysfunction. If it is an adult come to your clinic, if you are suspecting an thyroid dysfunction, especially hypothyroidism, you just ask the patient to keep the leg on their chair. You just stand up, ask the patient to stand up, keep the patient to keep the foot on this, and do the Achilles tendinitis. You just tap there with the knee hammer. So you just see the reflex. If there is a delay in the tendon reflex of Achilles tendon, most probably the patient have thyroid dysfunction. It's a very simple technique. Even if you don't have the facility to do the thyroid test, uh, this will give a lot of clue in the thyroidism. And another thing is look at the patient's edema in the face, the nature of the edema, the nature of the skin. These all give a lot of clues, especially in the hypothyroidism. But also be very careful that this may mimic some disease. For example, iron deficiency anemia. Very often people have, it may mimic most of the symptoms of iron deficiency anemia. And the male patient, also with the female patient, about 40, 45 plus, they have a continuous history of snoring, especially due to the obstructive sleep apnea. Better to check, because they have high possibility of hypothyroidism. These are oftenly taken as a differential diagnosis. Memory changes, vitamin D. Nowadays, a lot of people have this vitamin D deficiency. In the Western countries, we have Lyme disease, a very common thing. So it's a very simple thing to understand. So if you go to the standard textbook thyroid dysfunction, it is very, very complicated. So as a practitioner, as a clinician, I'll give you a simple tips to diagnose this. So remember this box. This is very, very simple box. If you have a patient brought with a thyroid chart, T3, T4, TSH. So you remember, you forget about T3. You just remember T4 and TSH. This is enough, actually, in reality. If T3, I mean TSH and T4 is normal, that means euthyroid, what you can see in the center box. Suppose if TSH is low and T4 is also low, so this is secondary hypothyroidism. Secondary hypothyroidism. If TSH is high, primary hypothyroidism. Okay. There is, if TSH may be normal, but if free T4 is low, then this patient may have some non-thyroid illness. Means there are many other diseases. There are malignancies. We can see the changes in the thyroid hormone. In the pregnancies, there are changes in the thyroid hormone. There are many situations where you can see the alteration. So keep it in mind. And the reverse way, again, if the T4, free T4 is high and TSH is normal, this means that person is on thyroxine. Maybe the patient is taking more thyroxine. Very simple. The doctor might have been told to take 100 mcg. 75 mcg. Person may be taking 100 mcg. There may be, after a period, doctor may have to reduce the dosage of thing, because he may be calculating the thyroid protocol. So that often happens. And the other side, if you see low TSH, 0.01, something like that, and high T4, then primary hyperthyroidism. And the other side, high TSH and very high T4, then it is secondary hyperthyroidism. This chart is very simple to remember. If I put it in a little more elargic way, this is the pattern. Normal. So euthyroid, then this is the thing. I don't want to describe this in detail because it may take more time, but remember that if just TSH is high and T4 and T3 is normal, it is not really necessary that the person is having thyroid dysfunction. It is called subclinical hypothyroidism, and this can happen very physiologically. Suppose if I go for a Himalayan trekking, my body needs really a metabolic push. So my TSH may be high. If some of my family members die, imagine some of our family members that die, and there may be change in my metabolism, it also increases the TSH. So there are many physiological situations where serum TSH can be high. So we have to exclude this possibility and then only we should arrive into a condition called hypothyroidism, which is called clinical hypothyroidism, also known as primary hypothyroidism. I hope everybody is able to follow me. So now let's go to the management. So you know how to diagnose. Now directly we'll go to management. So if you understand the symptomatology, it is very easy, because in hyperthyroidism, most of the time there is a huge increase of pitta and vata and the decline of kapha. So kapha manda, pitta vada pradhana situation is there. So the treatment will be opposite. Pitta vata shamanam, increasing the kapha. So the prescription could be like a pittahara kashayas, like we can start with the drakshadi kashayam, vidaryadi kashayam, tiptakam kashayam. These are very simple prescriptions. Most probably, if possible, made like a toya pakam and give for multiple doses. That draksha madhuka kashmiri shariba of Kayachikitsa, or vidari panjangla vichigali of Ashtangardem Shodhanadikana Sangram, or Padawalandam Pakadugadarvi Padadurala of Kayachikitsa Tiktakam. All the three yogas are very good for pitta vata shamanam. We can use that. Or simple toya pakam like shariba chandana ushida. Remember the khana chandana shundyam varpada ushida sadidam, like shadanga, you take few toyam, give it. Remember that situation is atyagni, so we have to reduce the agni. So we can use snehapanam like a kalyanagam, and virechana, especially pitta shamana type of virechana like ayubatti churnam. Sarve sama samasida shaudrena gudigi krita. Ayubatti churnam will be a very good result. Or even Shira Kashaya with the Truvut or Shyama can be used. Thalabodichil gives very good result, especially those who have hyperthyroidism. And normally, no Svedana, we can do Snehapana and Videchana in a right way. How can we diagnose a hyperthyroidism? In a clinic, somebody comes and complaining that they have a recent weight loss. In last 1 year, they have lost more than 3 kilos without any new diet plan, without any strainful thing what they do. One of the major diseases could be, one is a hyperthyroid. Second is some onset of some malignancies. Third may be a diabetes. Fourth may be a tuberculosis, which is one of the rare nowadays comparing to the rest of the other 3 diseases. So it comes very oftenly in a general OPD, it may be a diabetic, because a recent weight loss often gives a clue for irregular management of diabetes. But parallelly, we should not forget that this may be also due to hyperthyroidism. Okay. So maybe another management method maybe depends upon the symptoms, like Mahatiktakam Kashayam, which is just next to the Tiktakam Kashayam, or Shadavidyadi Kashayam, or Padavaladi Kashayam. Repeated virechana like Sugmar Erindam or with Shadangam except Shundi. Repeated Toyapaga will be of excellent usage. Vidaryadi Ganakwadam with the Shira Kashayam can be used, or Padushagadi Leham, Kushmanda Rasayanam. These are excellent for reducing Pitta Vata, and symptomatically it can bring excellent result. From a Resaushadha point of view, Pravala Basmam shows excellent result. We can give 100 to 200 mg VD with water. Kamadugarasam, very good. And Legushuddhasegarasam and Shangabasma also would be very good. I have been using these medicines, but my friend Dr. Jidesh from Ayurvedishala, he has been practicing this a lot. So he has shared me this idea. I was also started using this medicine recently, and it shown very good result. Now comes to the hypothyroidism. So for hypothyroidism is concerned, the symptoms are in other way, where we have an increase of kapha and also associated with kapha with vata, and there is a huge decline of pitta. So we have to have a kapha vadagara chikitsa. So instead of the drakshadi vidaryadi, we have kapha vadagara yogas like Gugulu Tiktakam, which is mentioned in the Vadavyati, Nimbamada Vishapadola Nidigdiganam Yogam, or Varanadi, Varana Sedikut Mashadavadi, the Hanamoda Villu Shaniga, that Shodhanadigan Sangram Kashayam, or Panchakolam Toyam, excellent. Excellent. Panchakolam Toyam is something which we should use by and large in this. I personally felt that there was a tradition in Kerala to people to use ginger water wherever we go in the hotels. I mean, wherever we go to any restaurants, even the local hotels, they used to give ginger water or padimukam, that patmaga, or this type of things, which is keeping our agni very well. Very unfortunately, this old water consumption has been replaced by this packed drinking water, which was not at all good, doesn't have any minerals at all, and moreover it create a lot of disturbance in the system too. We don't need to have that type of water in reality, but this is a fact. So panchakolam toyam could be a choice. We have to have a proper diet which should improve the agni, because the situation here is a mandagni there, so we can improve this. Another excellent formula for hypothyroidism could be the Dadimadikritam, which is mentioned in the Pathophysiology. Many of the symptoms which mimic Kapaja Pandu, Kapha Pitta, Kapha Vata combination of Pandu, there is no description like in Pandu, like Kapha Vata type of Pandu, but we can assume some Sargena, Sannibadena can be assumed, no? So Dadimat Kudabodhanyat Kudabadram Balam Chitragam Shingi Veram Yogam of the Pathophysiology of Ashtangardim. Excellent yogam. Even if you have a fresh case of thyroid dysfunction with hypothyroidism, TSH is 20-25, if they are not started with thyroxine, you can start with the Dadimadi Kridam, small dose every day, and definitely after 15 to 30 days, there is a remarkable decline of TSH level, because Dadimadi is one of the excellent formula that can give. We have formulas like Hamsabatyadi Kashayam, Hamsabatyamadaniba, Pipili Vishageshadam, also gives very good result. Comparing to hyperthyroidism, hypothyroidism is easier to treat, but it takes longer time to manage. So we can use Nimbamrita, castor oil, Sindhu arundam, depends upon the symptoms. Patient is having constipation, we can use that. Patient is telling that they have a lot of water retention in the body, so we can do Takradhara and Uddurtanam in the inpatients. Excellent result. There are good studies happened in Trivandrum Ayurveda College showing Vamana is a very good result in hypothyroidism. Also, in the cases of goiter, they made Jalaugacharanam in the locally shown very good result. There are studies also shown good result on Ayaskirdi and Gomutra Hedidigi too, but maybe nowadays not many people are using this, but it shows very good result. Depending upon symptoms, we can use Hamsabatyadi Kashayam, Punarnavadi Kashayam, also Varanadi Kashayam, etc. There is, as I mentioned to you, there is no hard and fast rule that we have to treat hypothyroidism like this. Modern medical people do in a different way. First of all, these diseases are diagnosed in modern medical science based on the biochemical markers, not on the symptoms. I've spoken with many of the endocrinologists personally. They told, doctor, we do just check about the T3, T4, TSH and we keep on monitoring this. There is nothing else we do. I asked, if you have a hair loss of the patient, what do you do? Doctor, we give some supplements like vitamin D, calcium, Evion, like, B complex. But we Ayurvedic people have a clear understanding. Okay, when we have a Rasadhadu level, we can do this medicine. When we have like Punarnavadi, when we have Raktadhadu, we can have another set of medicine. Like that, we are much better actually in reality in handling thyroid dysfunction. Unfortunately, still people are not really aware of this management. So we have Kanjanara Gugulu, Kaishwara Gugulu, Rasasinduram and Annabhadi, excellent yoga. Rasasinduram acts as a real penetrating combination with Annabhedi Sinduram. Another product like Soyamagni Sinduram, excellent result, especially in hypothyroidism. Shaddarna Churnam, even if you don't have any other medicine, simply you keep on giving Shaddarna Churnam. It gives excellent result. And in another disease, part of the thyroid dysfunction is Hashimoto thyroiditis. You all know very well about Hashimoto thyroiditis. It is an autoimmune manifestation of the same thyroid dysfunction, but situation is slightly complicated because a small amount of cells which stays in the thyroid gland, the thyroid nodule, uh, try to distract the stroma cells of the thyroid gland itself, producing a lot of problem, which has been diagnosed as Hashimoto thyroiditis, and it can be diagnosed based on the NDTPO, thyroid peroxidase hormone levels in the blood. I'll give you some examples in the clinical practice what we see in the reports and other thing in the coming part. So in the first stage of Hashimoto thyroiditis, we have to start with the Pitta Shamana, then go to Kapha Shamana, then we go to Rasayana. Maybe we can start with the Pravala Basmam, Kasisam or Loha Basmam, go to Swayamagni Sindhuram, or Abragam, Shilajatu, Talagam, and like that, or Lagusudha Shegaram, or Kanmada Basmam, or Shwasaguda, or some Surya Parpa, like those who are having those medicines having Valsanabi, also very good because it can really increase the Agni. Only be a little bit very careful when you have a product of Valsanabi. It have a tendency to reduce the cardiac activity. So maybe person may go with a low heart rate or low blood pressure. So those are the patient who is already in the low blood pressure, be very careful when you use Surya Prabha, Vitumaran and other products. Sudhashegarasam, Murtijayan. These are some of the excellent yogas, shows excellent result, and we can really bring good result. Beside the above all the situation, we have symptoms. We have symptoms which stands out of either of these two. One is the constipation, which oftenly seen even in hypothyroidism and hyperthyroidism, and some joint inflammations, muscle cramps, aches, and heavy menstrual periods. Oh, I have a lot of questions in the chat. I think I have to answer this at the last. Is it right?
Yes, in the
Yeah?
last.
Okay, fine. So I will continue. Shall I continue?
Yes, sir. Please do.
Okay. Yeah. So there are some symptoms that stands out, like muscle cramps, aches, heavy menstrual periods too. We have to be very careful, especially if a thyroid dysfunction happened to a woman of 45 range, because many of the symptoms may mimic as that of menopause, premenopausal syndrome. So that's why I put a chart there, as you can see there, between the age and which is the pain, hair loss, and test, which gives a better result. A simple thing is just check TSH and FSH level. You know, when you have a menopausal change, so you have a change in the FSH, which TSH doesn't has. Again, as we all know, basic line of treatment to tackle kapha and medovriddhi in hypothyroidism. So all the kapha measure has to be taken, but most oftenly people have a wrong notion that many symptoms are increasing the vata. So we have to be very careful about that. So if you look at the international platform, where people will say that we have to be low glycemic food, we have to cut down the sugar and sugar content, it is true too. And very interestingly, some of the observations are that whenever patient undergo an upavasa or the fasting, there is a strong changes in their metabolism. Because of that, their TSH can lower. But I parallelly made many studies in my patients during the Ramzan period, and in many patients, instead of better the situation, they have a worsening the situation of thyroid. Maybe they are not taking the diet in the right way what they are supposed to do. Again, Kabhara food like Ruksha Alpakadu is very essential. Dwartanam, excellent result, especially to reduce the joint pain, water retentions, and overall well-being of the patient. We can use Ruksha Sweda. Be careful, podiki like Churna Pinda Swedam and or Valuga Swedam and all we can give. But be careful that you are not increasing the vata. Vyayama exercise is very essential for the hypothyroidic people, not in hyperthyroidic people. Yoga, very good. It will give very good mental stability to them. Breathing exercise, Lekhana Vastis. I'll show you one of the Vastis which can give very good result. Vamana shows excellent result, but it is very difficult to convince the patient to come for a Vamana in the hospital. But once they are convinced, especially for Hashimoto thyroiditis and all, once they are convinced, definitely it could be excellent to have a Vamana, at least a Sadhya Vamana. Repeated Nasya can bring good result, especially in the mood fluctuations, especially in those who have recurrent headaches, hair loss, will give good result. Thumapana also give good result. Minimum to give a Nagara or Shundi Jala or Panchakola could be of very good help. If we get patients in the hospital after a course of Uddhavartanam, Ruksha Sweda and all, if you are able to give a Ruksha Vasti, like Lekhana Vasti, for Makshigam, Saindava and Murcha Tailam, the same Yavanyadi Kalkam, Trifila Kashayam, Dhanyamlam and Yavaksharam, if you use in this, Dr. Padmanabhan from a former DMO from Wayanad, he was using this Lekhana Vastis by a large, and we also tried these Vastis in some cases and shown very good result. So we simplified this also by from Trifala Kashayam to Kulata Kashayam and Makshigam. Instead of Sneham, we had started using Pipalyadi Anvasana Tailam. Instead of Kalkam, Yavanyadi to Hengujadi Churnam, like that. We can modify that. Very importantly, generally attempting for a Snehapana is not very fine in the hypothyroidism patient. But in hyperthyroidism, maybe we can, but we have to be very careful when doing with Snehapana methods in the thyroid dysfunction patient, because it's directly related with lipid metabolism. It doesn't mean that it will end up with some complication. Rather, it is very challenging to get a proper result. But Tilatailam could be a better choice than a ghee, because most of the milk products, milk, ghee, or the things are generally, it's not very good, especially in the hypothyroidism people. I often tell the people to stop using these products if possible, because it keep on, the Swadabhagarasam Snigdam, Ojasyam Dhaduvardhanam, Vadavittaram Snigdam, Shleshmalam, Guru Sheetalam. This is the problem. It is Shleshmala and Guru and Sheetala. All these three are completely opposite that of, it is very same to that of the Nidana of hypothyroidism, better. And definitely Divasapnam is another very common thing to manifest hypothyroidism in many people too. So strictly prohibit daytime sleep. So by this, I'll just go to explain you some of the cases, unusual cases, not usual cases. Okay. As a clinician, many of you might have seen many cases of hypothyroidism. There are three categories type of people come to your clinic. One, a genuine hypothyroidism case, maybe rare, but still they come with the complaining of hair loss, edema, and other thing. They may themselves may be suspecting hypothyroid dysfunction, or you as a clinician may suspect a thyroid dysfunction. So you will send the patient to check for T3, T4, TSH. So you have a primary patient. So he come up with a report saying that, doctor, I have TSH now, it is 40, and T3, T4 looks normal, but maybe some changes in the T4. What you are going to do? So you know that it's already maybe a subclinical hypothyroidism or maybe a clinical hypothyroidism with many symptoms. So you may start giving prescriptions like Varanadi, Kanjana. That is one type of people. You may get successful. Another group of people comes to you with already they are taking thyroxine. They want to step down to reduce the dosage or to have an avarohana of the dosage of thyroxine. They'll ask, doctor, do you have any Ayurvedic medicine for this thyroid dysfunction? So that is the second category of people you may address. And third category, people will come with a thyroid goiter, maybe a nodular goiter. And the important thing to convince the people is that thyroid dysfunction and goiter is not directly linked. It has a link. Whenever our body has a great demand of a thyroid hormone, body definitely creates a potential to initiate thyroid hormone secretion. Just like if I climb to a very high altitude, my left ventricle become large, called left ventricular hypertrophy. It's a physiological LVH. Similar way, there is a period in the body when the thyroid gland enlarges in a bigger size. So thyrocele, we can say thyrocele. So this can be a goiter. And once it is enlarged, it takes maybe years to back to the normal size. But in the biochemically, when the situation comes to normal, he may be normal. He may have biochemically, he may be T3, T4, TSH, may be normal. So we have to make them to clarify that you have a goiter, maybe a unilobular or bilobular goiter, doesn't mean that you have a thyroid dysfunction now. You might have faced one period in their life. That's all. It's very crucial. Again, a lot of people will say, doctor, I am taking thyroxine, other thing. I don't have any thyroid enlargement. You see, doctor, you look at my neck, I have no problem. But many of their neck may be quite bigger, a lot of fat depositions, and may not be visible outside. If you make an ultrasound of the neck, maybe showing that there is a change in the thyroid gland, enlargement of thyroid gland. Because since the thyroid gland is a very soft tissue, it really closes with the touching with the fat here and doesn't show. If the person become lean, this may enlarge along with the Adam's apple around. So that's again misconception may be there. So I'm not taking these type of three category because these are already known to all of you. We speak a little bit advanced aspect of this, which one case, a girl, Kirti, in 2017, she came with a report like this. She has a, look at the report, the TSH is 10.29 and NT-TPO 600, which is supposed to be less than 40. At the age of, she's quite young, age of 14, just 14. And at ATA, the thyroglobulin anti-thyroid is also very high. So she consulted the doctor. So she started taking thyroxine daily, and situation not happy. She started taking thyroxine, but she has all the problems. She has some difficulty in the growth. She has a problem in the menstruation. Lot of symptoms she has. So she consulted, and we checked again in the thyroid gland. We checked there is a thyroiditis, just to have a thyroiditis. And we started giving Ayurvedic medicine, and parallelly, and look at here, the TSH comes to 8.46 at the age of 10 to 15 years. That is normal. Don't compare with the adult where it is because 0.4 to 4 or 0.25 to 5, depends upon American Thyroid Association, or there are different associations, endocrinological association, they have different charts. So normally in an adult person, it may be go up to 0.7 or 0.5 to 5 or 0.7 to 7. But for the child is concerned, it can go up to 10. It's okay, fine. So this is the situation. So this one side, very important, a child, thyroid hormone is very, very crucial for the growth hormone. It is very, very crucial to development of the reproductive organ. So don't take risk or stopping the conventional modern hormone and make a risk of thing. We may be successful. I have successful stories, but I have failure stories also in my life. As a thyroid, hundreds of cases when I have treated. I have failure cases also. One girl, she was under my treatment for thyroid. Everything was under control. She got married later after a year. She stopped all the medicines. She got pregnant and she developed thyroid dysfunction, and she went into a situation that she has to have MTP, medical termination of pregnancy, because of the poor performance of thyroid. She was under my medications in a right way. Everything was quite normal, and she didn't made any proper follow-up, and she stopped because she got married and she was not able to carry this medicine to the husband house, and there are the usual emotional stories. But in reproductive age, we better not to take such risks. Doctor told we have to go for MTP. It was a really sorrow for that girl as well as to me too, because it was very unfortunate that that situation happened. We could have managed it much. Even she says, okay, after marriage, if she says to me, doctor, we are planning to have a child, shall we have a balance of the thyroid function? Yes, it is possible. It is possible with Ayurveda. But so there are failure stories too. Another case, look at this. This is a WhatsApp conversation I just added here in these situations. One patient with a T3 is 435, T421, TSH is 0.01. So it's a typical case of hyperthyroidism. And you see the prescription. This is one of our students, Ayurvedic doctor. So she given Drakshadi Kashayam, Kanjana, Gugulu, Dadimadi, and all. So I told her, no, better you change this formula into other thing and change these and these. I was keep tracking to them. The level become TSH after some period. The level become same. T3 and T4 level improved in hyperthyroidism. So the allopathic modern medical doctor told to have a thyroidectomy because thyroid gland is too high. Because of the TSH is keeping high. So I told, no, you just admit the patient. Inpatient required, do the symptoms improved, so weight gain, tremor, palpitation improved well. So let's go further. So like that, they convinced, IP treatment given without a surgery. We have, because there's a hypersecretion of T3, T4. So modern endocrinologists told you have to do a complete thyroidectomy. Normally they don't do. They maybe keep a small part and do that partial lobectomy. But things are like that. But we are treated very successfully that case. These are very, I'm speaking about unusual presentations. This is another case. Sarama in 2015 came in the clinic. T3, T4, TSH was normal, and she was taking the medicines, and she thought that everything is normal. But after 2 years, she again go for the thyroid gland check, and the size is increased, really increased. In 2 years, the nodular goiter is alarmingly increased. And look at the hormone level. The T3 is only 124 only, T4 is 10, TSH is just 0.417. It's quite normal. So what does it mean? So she developed a nodular goiter, and the condition is enlarged, but obviously it is not a malignant so far. So we treated these cases also with the local applications and everything. So this is another case in 2015, enlarged with hypochondrial nodule in the both, and look at the TSH level. And again, actually this was not in the thyroiditis situation, was not there, but later on they developed into mild thyroiditis and also some cervical lymphadenopathy. Be very careful when you are examination thyroid gland. Check about the submandibular thyroid lymphatic glands and all, because there are situations where thyroid malignancies are high. Last year in 2009, the International Thyroid Conference happened in Cochin. Instead of normally it happens in the big cities in India. So last year it happened in Cochin. So one of the endocrinologists was speaking there, and he was saying that statistical data shows that Kerala has the highest number of thyroid malignancies. So probably we have to be careful about thyroid malignancies. At these situations, I think it is not the right time to speak about malignancies at this. So in nutshell, we can treat hypothyroidism and hyperthyroidism very well exclusively with Ayurveda. If you have a fresh case, TSH maybe 15, 20. If you are a good endocrinologist, Ayurvedic thyroidologist, we can handle most of the conditions. If people ask, doctor, do you able to withdraw the thyroxine, which I have been taking from last 4 to 5 years, we can say yes, it is possible. It takes long time, from 4 months to 12 months. We can slowly withdraw. If patient says, doctor, I have Hashimoto thyroiditis, then we have to explain them that this is more complicated expressions of the thyroid dysfunction, and it needs longer time of treatment. It may need inpatient treatment. And there are some of the best medicines like Dadimadikridam, Hamsabatyadi are the best medicines what we can use. And there is no shortcut, there is no quick fix, there is no fixed prescription. Okay, we can say some prescriptions, but it is better to think about Ayurvedic way, very logically, find your own prescription, which is much more successful than any of the other prescription what is available in the books. As I mentioned in the beginning, as rightly I told, since in our textbook these diseases are not described, so this is an opportunity for us to think in our own way and present and bring clinical results very successfully. We can handle both hypothyroidism and hyperthyroidism as well as Hashimoto thyroiditis. That's all.